by making it a much simpler process. In the spring, external interviews were conducted with key stakeholders, including the Department of Social Services, our certified application counselors throughout the state, navigators, and brokers, to learn more about their experience when enrolling our consumers and discussing with them any opportunities that they saw for improvement. We also held internal cross-departmental brainstorming sessions, and this was to identify areas for enhancement with our own staff. And the steering committee for the 10 Clicks project also spoke to other state exchanges regarding their enrollment systems and any enhancements that they had done in the past few years. Out of that, a user experience blueprint has been created, which we're very excited about. And from the interviews done in the spring and the work sessions, this blueprint identifies some strategic initiatives for Access Health CT to explore in the next phase of the project. The next steps for us are to build action plans for each of these initiatives and how we would execute on these recommendations that have been gotten for us. We're excited as we continue to move this project forward to make enrolling and renewing into health coverage through our Access Health system a simpler and better experience for our consumers. Any questions in regards to 10 Clicks? Okay. Not seeing any. Martine, can you go to the call center updates? I'll be giving that also. So as James had referred to, Access Health and the Department of Social Services partnered at the beginning of this year to develop the call center services request for proposal document. The goals of this project are to ensure that we're receiving services at a competitive rate, as James had mentioned earlier, and that our call center vendor will provide exceptional service to our consumers and that their mission and values are aligned with ours. So on July 12th, Access Health issued the call center RFP. We have closed that in August, so we have received respondents. And as James had mentioned, there are 4 that will move through the evaluation process. So we continue to do that. And as we move forward with that project, I will continue to give updates to this committee. So thank you for the time to share the updates on these 2 projects.
Just one quick question. How robust, if you're able to say, has the response been to the RFP on the call center?
You mean from the respondents?
Yes.
How robust was, we haven't.
I'm sorry. You're working on it.
An evaluation process, so we're going through it now. So I'll have more information, at our next strategy session.
And Steve, initially, we had about 10 respondents to the RFP. Of that 10, only four met our requirements, the requirements in the RFP. So that's why we filtered it down to 4, the top 4.
I see.
And then they continue to go through an evaluation process of us scoring them.
Great. Thank you. Thank you. That answered 2 of my questions, but thank you, James, for that clarification as well. Thank you.
So let's move on to John Ikra.
Good afternoon, everybody. Hope everybody's doing well. As many of you know, over the past several months, well, more than several months, 6 to 8 months, we've been working on coming up with a solution here in Connecticut for our small group employers and our employers. We've been working on an RFP process. As we've gone through that, we've come to the conclusion that we've decided to probably, most likely go out and start building a platform. And what that means is we're trying to simplify the process. We felt it was necessary that we evaluate the marketplace, see what was out there, and see if there's a tool that we can develop that will help our employers and our brokers and our employees be able to shop for an individual plan through the exchange, but still have that small group feel. So over the past several months, we've been working with a vendor on going through that and having a number of brainstorming sessions with them to build out this platform. Currently, right now, we're in the process of developing that platform and going through the scope of work and all the different types of business rules and wireframes. So I'm going to give you guys some kind of background information of, what our months. What our first goal is going to be to establish it, get the platform up and running, and do a soft launch for 11/1. And what that soft launch means is that we are going to have brokers come in and evaluate how the platform is working. Does it meet their needs as a broker, employer, and employee? Is the workflow simple? Is the information that we're giving them, are they able to consume it? Are we able to have that employer and broker understand what's the best route for them? It's either going to be the individual side through the exchange, the individual side through the ICHRA platform, a small group product, or potentially having them stay where they're at on their currently partially self-funded program or fully program. Also, too, we want to make sure we're meeting all the ACA requirements, IRS requirements, and CMS requirements, that we're doing everything according to the Individual Coverage Reimbursement Arrangement Act that was created back in 2019, if I'm correct on that date year. So we want to make sure that we meet all those criteria. As we go through that and we kind of fine tune that in that focus group, we will then bring all that information back, and we will continue to develop the platform over the remaining 3 to 4 months. And in Q2 of 2025, which will be a 7/1 effective date, we are going to then have a fully baked product that we will be able to introduce to the entire marketplace. As we do that, we are going to be working on a marketing campaign throughout this entire time frame. So we're going to start introducing the employers, the brokers, the employees, little by little into this process, but also all the other stakeholders, our board of directors, our elected officials, our strategy committees, our advisory committees, and making sure they understand the concepts and having them join in and have us help them reach out to some of these groups. For our soft launch, we are going to be focusing on non-for-profits because we feel like this is a segment that's in need, and we feel like this product can tremendously help them because they can be able to play on the contribution amount versus the APTC amount and which one is going to best work for them. As we always kind of say, they can't have them both. It's one or the other at the moment through the platform, but these are all going to be the education things we have to do with them. This is a pretty complex product. And we feel that over the next 3 to 6 months, we're going to be able to streamline it, fine tune it, and be able to communicate it out through all the channels that are necessary. So we're really excited for the complete, fully. Any questions regarding that? I'd be more than happy to take them.
John, I just got a little lost. Can you just work me through? So 11/1, we're going to have a pilot. Our hope is that 5 to 10 small employer nonprofits are able to come in and sort of see if it works. If it works, they'll start enrolling their employees in this as of 11/2 kind of thing. Is that right?
No, Matt. So the way the IRS, with ICHRA, there's a kind of, the IRS has a little law that we have to notify every single member that an ICHRA option is being offered to them. So there's a 90-day window. So at 11/1, we will start that process through the platform. We have to have all those notifications in the platform documented, and they have to attest to every single one of them. Then they have to go through that 90-day window. So the earliest we can have someone from the 11/1 pilot set up will be 2/1.
Got it. And then assuming all goes well, 7/1 is when we would say doors open.
7/1, yeah, we're going to start planning. Hopefully, we'll be able to kind of get a lot of those bugs out sooner than later. And 7/1, we'll say doors are open. Let's go. We're going to start marketing in 90-day advance clips to get people up there. So it's going to take a little while to get it going. Yeah. The great part is once you get it going and we do bring the groups on, they will follow the normal OE enrollment. So if we bring on members for 7/1, 11/1, they're going to start going through the OE process for 1/1 the following year, and they will follow the same cycle.
Great. No, this is a great program, and I'm glad that you all are leading the nation in this, and I think this is great. That's why. Currently,
right now, there's no one building the platform. A lot of the other platforms that are out there are very, I want to say, they're not even broker kind of angled. They're more of the platform wants the business to come into them and they want to work it. we felt like it was necessary to give the brokers and employees a little bit of a breathing room and give them something that they can use without having to charge the client. Broker has to charge the client. It just becomes a little messy. It's just kind of a lot of technology, and we just got to make sure we get it right.
That's great. Thank you.
You're welcome, sir.
And just, sorry, John, this is Susan. Just to add, as John's mentioning in his example, the enrollment, at different times in the year, the ACA does provide a special enrollment period for an employee who's offered an ICHRA out of the cycle of open enrollment. So they would start in that year, and then obviously then they'd be in the individual plan renewal cycle.
Okay.
So Matt, and I know we said July 1st, but if we are able to start earlier than that, we will. So we're just giving ourselves some cushion to get it done right. And the intent here is to give small businesses more options for their employees to buy health insurance, and some may qualify for subsidized health insurance, therefore making it more affordable for the employee, and also whatever contribution the employer is putting towards the employee's coverage stays in his or her pocket. So this is benefit all around. Now we plan on during the month of October, we will be going around, meet with the governor's office, meet with other elected officials, also our board, to demo the system for them, so that they will get a feel and look at how the system is going to how the system will be used by brokers, employers, and employees. Again, the intent is to make it as easy as possible. More importantly, get people access to make it more affordable for employees to get health insurance through the exchange.
Mm-hmm. Thank you.
Welcome. Any additional questions?
No, I want to echo what Matt said. This is such a great innovation, and it really does respond to, I think, how do you serve those small businesses that, but for this type of platform and product, would otherwise have a hard time ensuring their employees together. So thanks for that.
Welcome. Thank you.
Thank you. So, is Katie on?
Yes, James. Hello.
Okay, go ahead, Katie.
Thank you. Good afternoon, everyone. My name is Katie Hearn. I'm the Associate Director of the Enterprise Project Management Office, or the EPMO, at Access Health CT. We are currently tracking 19 projects and have been steadily preparing for Open Enrollment 12. Over the past several months, we've been creating the work plan for OE12, and we've been regularly meeting with our stakeholder departments. We're on track for OE12 to begin on the usual date of November 1st. OE12 is expected to run from November 1st through January 15th. And I have some brief OE updates to share with you today, covering technology, marketing, and health equity and outreach. First, some technology updates. Rebecca McClear, our Director of Technical Operations and Analytics, wasn't able to join this call, but if you have any further questions, if you need further details on any of these items, we're happy to follow up with her on anything additional that you need. First, I wanted to highlight that this will be the first OE in which crosswalking and auto renewal will be available for those enrolled in catastrophic. Longer eligible for catastrophic health plans will now be crosswalked and able to be auto-enrolled into some other coverage. Previously, we were not able to do this. And just as a reminder, yes. As a reminder, typically catastrophic plans are available to those under the age of 30. They can also be available to those 30 or older who qualify for a hardship exemption or an affordability exemption. And we do have a screen change. We have made some improvements to the renewal options display in our enrollment system to improve the customer experience this year. And importantly, we are preparing for those with deferred action for childhood arrival protections, or DACA individuals, to be able to enroll for the first time in qualified health plans and to potentially receive financial assistance through Access Health CT, this OE. Next slide, please. I have a marketing update to share. The Director of Marketing, Caroline Rouette, will be able to provide you with any further details you may need on these items. First, marketing is activating its focus group feedback to assist with its advertising campaign for TV, radio, billboards, and posters, and a variety of digital media. Marketing is in the process of finalizing its media plan, paying special attention to the uninsured, underinsured, and underserved communities we serve. The marketing department is also preparing its PR strategy, including messaging, the timing of press releases, media alerts, and potential press conferences. Marketing is drafting direct-to-consumer content via mail, email, and text messaging. That's to encourage our consumers to come in and create online accounts, and to also allow consumers to opt in to email and text messaging, because we know that's often the preferred way to communicate now. And the marketing department is also reaching out to consumers who may be able to renew their Covered Connecticut coverage or enroll into the Covered Connecticut program for the first time. Lastly, the Access Health website will have new content for the open enrollment timeframe, and that will include information for newly eligible DACA Connecticut residents. We've created additional materials as well for our community partners and for the health equity and outreach team to extend the reach of our messaging. The next slide, please. Thank you. And then some updates from health equity and outreach. Again, any further information you need on any of these items can reach Tammy Hendricks. We have our virtual Healthy Chat scheduled again this year. Informational meetings open to the public that are scheduled for the first Wednesday of the month from 6 to 7 p.m. We also have community partner chat and learn Zoom meetings. Those are often geared to partners like our certified application counselors who assist with our enrollments. That gives them an opportunity to ask questions of Access Health CT. We have also plenty of in-person help available as usual. We have enrollment assistance available through enrollment fairs, our navigator organizations, which are located in Hartford, Bridgeport, Waterbury, New Haven, Norwich, and Willimantic. And we have ongoing help at our static enrollment locations at the East Hartford and Stamford Public Libraries available this OE. Thank you.
Yes, question. For the board meeting, you don't have to do this for now, but when we do our board directors meeting, I always ask these questions of, what are our goals for OE12, right? How many people do we, new people coming in? What is our projection for auto enroll? Where, right? Where are we focusing? Is it Eastern Connecticut? Is it the cities? Where do we feel like there's populations that aren't being served that we can get to? Always curious for those numbers and how we're thinking about that, right? We're at 115 or so right now, I think. It's been a while since that was the number. But is our goal, do we think we'll be at 119 at the to 110, that kind of question.
Yeah. So Matt, we're right now we're a little bit over 136,000 right now.
Okay.
Over 136,000. We think the numbers at this time usually is a lot lower than that. We think Covered Connecticut has been very, very helpful in helping us to maintain the enrollment numbers. So again, we are still looking at the meeting tomorrow. Next week, we will have but some projections in terms of our target goals for enrollment for QHP and possibly even Covered Connecticut.
Cool. Thank you. That's great.
So we have that for next Thursday. But right now we are at 136,000. Usually this time of year we're down to below 100, and Covered Connecticut has been immensely helpful as well. The enrollment numbers, so we are very proud of that. But it's an entire collaboration of across the state agencies and us, DSS, OHS. Everyone's been working very collaboratively to keep the numbers as high as possible. But we think there's room to grow. We will give you some our target numbers next week.
Great. That's great.
And I just, Matthew, I just want to make sure I couch caution my statements in that our numbers are driven a lot of times by the economy. If the economy is doing very well, people start getting insurance through their employer. Our numbers may dip, not necessarily because we're doing a bad job, just that the people are getting insured through other sources.
Yeah.
Yeah. Thank you. Tammy.
I have some Broker Academy program updates for you today. The program year 3 is nearing its final stage, and the students are staying engaged throughout, which is always great. I'll provide an update on our progress, starting with the mentorship program. And of course, I think this is probably the most important part of the program, as it provides students with the hands-on experience and practical skills that they need for their certifications and to enter the open enrollment period fully prepared. So throughout the mentorship program, which started in July, our teams have continued to meet with the students and the mentors on a weekly basis. These meetings are really important. We're getting feedback from the students, making sure that we're addressing any challenges they're having, and really just keeping them on track. And I just wanted to emphasize that we have weekly meetings with our students from the very beginning. So when the program started in May, and they have continued throughout. And so the students really enjoy that. It keeps us up to date and it keeps everyone on track. We're also helping the students prep for their Access Health certification, helping them get through that process to get them ready for open enrollment. And they're also working with their mentors to help them with the Medicare certification process. Most of them are doing that. And this is important because it will, expand their scope of business and better serve a very vulnerable elderly population, which we're happy that they can tap into that market. In addition to the weekly meetings, we're consistently communicating with them, providing them resources through our newsletters, right? Keeping them up to date with trends, important deadlines, any updates for the program, and also throwing in some tips on the certifications, exams, and reminders of upcoming events. So those newsletter, they fill the space in between the weekly meetings for us, communicating with them. John and his team, the broker support team, have some webinars coming up, not just for Broker Academy students, but for all brokers as well, to complement the certification process and help them all get through that. And so we're happy to have John and his team working on that with the students as well. And all of these efforts will continue until graduation. We are really excited that the graduation is coming up. We have it scheduled for October, and we can't wait to celebrate the students. This is a huge accomplishment and milestone for them. And now they officially transition from being students to certified professionals, ready for open enrollment. So that's really exciting for us. So over the next few weeks, we will continue to concentrate on preparing them for the certifications and getting them ready for open enrollment, and where they will participate in a lot of the in-person enrollment fairs that my team and I have planned for upcoming open enrollment. That concludes my presentation. Happy to answer any questions.
Just a quick question on my end. In terms of continuing education, continuing post-certification, is there any strategy to expand or develop in that way, or are you already thinking?
They are tied into the general broker, the broker population for us. And so we do have ongoing in-person trainings and meetings for our brokers and CACs. And so they're incorporated into that. And we kept that way so they get the experience with the other certified brokers. And so they continue the journey with all of our brokers after they graduate the program. Keeps them on their toes.
Steve, a big part of this, as Tammy indicated, is the mentoring part. You get the license, you get the training, but now you have to do something with it, and partnering them with an experienced broker or experienced brokers firm, we think that's just a good start. In our third year, that has been well received. Both the mentor and mentee across the board, they really enjoyed the experience, and a lot of them continue to work with the mentor into the year. And we think the Medicare Advantage opportunity is a real great opportunity for them, not just to expand their knowledge, but also to earn a very good living. Commissions for a Medicare Advantage plans is very fruitful, if you will. So there are no other questions, Mr. Chairman. We can go on to the next item. Yeah. Okay. I think we have Caroline.
Yes, thank you, James. I'm Caroline Ruette, the Director of Marketing here at Access Health CT. ICHRA, OE12, and the Broker Academy are pretty tough acts to follow, but I'm going to give it a go here. We are here to talk to you a little bit today about a recent survey we conducted, and we're going to give you a little primer as we head into the board meeting next week, where we'll give you a lot more detail around the findings. Go ahead and advance the slide, please, Martin. Thank you. So ultimately what we did, folks, is we surveyed some of our customers about the impact of the Affordable Care Act on our customers. So what we were looking to learn was whether or not coverage through Access Health CT works, right? We've been here now for over a decade. Now is the time to really dive in a little bit deeper with some customers, especially those who have been with us for some time now. We wanted to know, has qualified health plans or Husky D coverage over time impacted the perceived health status and well-being of these customers? And I want to know and Medicaid that came through the Affordable Care Act. And so those are our customers that are impacted by the ACA. So we have our QHP customers as well as Husky D that were included in the survey respondents. We also wanted to know what ACA essential health benefits are most valued and utilized, right? There's a lot of services that became available through the ACA and the plans on the exchange, including those essential health benefits. And so we really wanted to understand what impact is that having on our customers. Also, are there any gaps in coverage and barriers to access and plan utilization? As it says in our name, access is key to what we're trying to do. And so we really wanted to understand the impacts that we're making there and how are people actually using that plan to be healthy after they gain access to the system. And of course, how can we improve? Go ahead and advance the slide, please. In terms of who we surveyed, I alluded to this a little bit earlier, but that did include the QHP folks as well as Husky D. They needed to be customers for the past consecutive 5 years. And so we really drilled into our data set to make sure that we got those appropriate people. We wanted folks who had been with us for some time so we could truly understand the impact. We fielded this research in May of 2024, and since then we've really been digging through that data, coming up with insights and some actionable plans as a result of what we've learned. And we wanted to make sure that when we were talking to folks, that we offered this in both English and Spanish. So that was included in our survey design. And we wanted to talk to folks who were the healthcare decision makers. Results did include responses from 360 members. And here's some demographics about who responded. Interestingly, it wasn't necessarily designed this way, but the responses were from 59% white folks, 24% Hispanic, and 8% Black or African-American folks. That's actually very close to the demographics of the state of Connecticut, which is really interesting. Again, not something that we originally designed, but that really stuck out to us in the data as we looked at the results. 77% were English speaking, 20% were Spanish speaking, and 3% were English or Spanish bilingual. Interestingly, the responses, our respondents skewed a little bit more mature. 68% were between the ages of 45 to 64 years of age. We know that the Affordable Care Act really made insurance more accessible to folks, right, that may be retiring early and kind of looking for something like a bridge before they were eligible for Medicare. So interesting just to see the respondents' age that came through. Almost 60% were female. Again, when we think about health decision makers within a household, it's interesting to see that skew more female as well. 10% had a child under the age of 18, so we did have parents here. 65% had a household income of $50,000 or less, with 44% under that $25,000, and 22% declined to share income. So, you know, there's a fair few folks who didn't give us that information, which could skew this. And if you're looking at that and thinking, hey, those income levels seem a little bit low, remember that Husky D folks were included in this population set. 33% were wage earners, 23% reported being self-employed, 22% were unemployed or a mix of retired stay-at-home parents, students, or flat out did not respond to that particular set of questions. And 31% of the people that responded were uninsured prior to having a plan through Access Health CT. So truly understanding these folks, meeting them where they are, and the information that they shared with us about the impact is really exciting. The full survey results are going to be shared during the upcoming board meeting next week. We really just wanted to give you a primer so you're aware of what's coming up. And we will make the full report available to you all as well after that presentation. So you can look at the data as well as our executive summary and our plans about what we're going to do about it. And so I will pause there in case there's any questions about, you know, why we did this research or kind of who we were looking to engage with, because I know that that's what we just went over. So if you have any questions about that, I'm happy to field it.
The only addition I want to is that DSS was a big partner of ours in developing the survey and sharing the information with them. So obviously this is, again, continues to be a collaboration between us and DSS.
Good point. Thanks for sharing that, James.
Just one question from me. In terms of the demographics that you reached, is there any sense or at least instinct that we may be able to reach a younger or at least more diverse demographic by using other types of survey access points?
So interestingly enough, this wasn't primarily a phone survey, which may be something that folks were thinking about. We did use digital communication. So we used email as our primary way of getting the survey respondents or survey responses. And so I was actually kind of interested to see that the vast majority were a little bit more mature. I think younger folks are also a little bit more wary of phishing attempts and things like that. And so we do battle that a little bit when we're trying to get information from folks, right? Asking about really sensitive things, whether it's over the phone or email. Some younger demographics are actually a little bit more savvy to that. So I think that that's also contributing, but definitely something to be mindful of. And we will think about being creative and making sure that we get the responses from younger folks included. It is present here. It's just primarily some more mature folks, but we hear you.
Thank you for that.
Sure thing. Anything else? All right. Well, I yield the rest of the time. Thank you very much. I appreciate it. And I look forward to re-engaging with you all. Oh, looks like, Sean, do you have a question?
Yeah, just real quick, the 360 respondents, do we have a sense of whether that is, statistically significant to the extent that we have a small margin of error for the outcome, the responses? That was my...
Great question. It was a topic of discussion, and I co-led this effort with my peer, Rebecca McClear, the Director of Technical Operations and Analytics, who was able to work with our third-party vendor to make sure all results were statistically significant. I will say that is where my knowledge trail ends, and I get a little bit dangerous, and so I would yield to Rebecca. She's not here today, but I will make sure that she addresses that, or we're able to address that a little bit more specifically during our board presentation next week.
But Sean, the answer to your question, yes, it was. Again, the vendor that did the survey for us, that was part of the contract, is to make sure what the results had to be significant. So the sample size we selected had to be.
Great, thanks.
And to add to that, and from Spanish-speaking folks was statistically significant too, to represent the entire data set. So we really made sure to have enough responses from that really important audience as well. Attention, I appreciate it.
Thank you, Caroline.
Thank you. And thank you so much for all the thoughtful presentations, and of course to the members of the committee for your thoughtful engagement. And it's very exciting. I'm excited to hear about all of this in front of the full board. And I congratulate you as usual for your innovation and for the way in which you really are unrolling a strategic plan and methodology that's in service to more and more people who can benefit from more affordable coverage. So thank you. Making the motion to adjourn.
So moved.
Thank you. A second?
I'll second. This is Sean.
Great. Thank you, Sean. And Marcin, if you could please conduct the roll call.
Yes, Mr. Chair. Steven Hernandez.
Yes.
Ron Ritter.
Yes.
Paul Philpott.
Yes.
Thank you. And Sean King.
Yes.
Thank you.
Thank you so
Thank you
much,
all.
everybody. And with that, we
Thank you.
Thank you all.
Bye,
See
everyone.
you
Take
all.
care.
Bye.